Well, the Antibiotic Guardian idea is really an idea to take awareness amongst the general public about antimicrobial resistance and use to actual action, so that it's a behavioural approach to modifying antibiotic use and developing much more appropriate antibiotic use. So what we're aiming for is for the general public and health professionals and organisations, in fact everybody, including you, to make a pledge to be an antibiotic guardian.
The issue about antibiotic resistance, I think it's surprising for a lot of people to learn that over 80% of the world's antibiotics are fed to animals. And as our demand for ever cheaper and more plentiful meat increases globally, so the proportion of antibiotics that are manufactured being fed to animals will increase. And so we have massive concerns about what that means in terms of antibiotic resistance, rise of the superbug. But in effect, it seems as though we're squandering one of the most precious innovations that we've had in the last 40 years.
Part of our task is to start really moving things along globally and trying to support the emergence of this kind of global consensus of the need to act on AMR, and trying to push forward getting countries talking about this at the right level and taking action in multilateral forums. So we're trying to get the G20, like I said, interested, and hopefully there'll be discussions in China next year, which brings together some really key governments around the world to talk about this. And also the UN General Assembly next September is going to be talking about AMR and talking about what the UN can do in terms of mobilising a response, just as it has done before with things like HIV and AIDS and Ebola.
We need the public to take action because it's public action that drives antimicrobial resistance, as well as what professionals do, and people can influence what professionals do through their own behaviour.
I go to my pharmacist and the pharmacist says to you, actually you've got a cough and do you realise this is going to take a couple of weeks to actually clear up? That's actually quite depressing, but at least I go back knowing there's nothing seriously wrong with me, and it is going to take that period of time to clear up. And there's a lot of research that does actually show informing people about the likely time course of their infection does actually have benefits when it comes to self-treatment.
So what we're going to do in the future, continue to promote prudent prescribing and stewardship through our online guideline, which, as I say, is freely available to all, and also through our journal. Collaborate with as many people as we can to highlight the problems of AMR and the need for judicious use of antimicrobials at every opportunity. Help to develop a freely available audit tool for general dental practitioners, and obviously promote prudent prescribing and stewardship throughout our teaching programmes.
We've recognised that effective leadership and expertise are essential, and the next layer of that is to monitor everything that we do, then intervene, then monitor again to see if we've made a difference. We've recognised that prescriber ownership is essential, so involving the prescriber in the audit process is really helping to improve the situation in terms of prescribing. Competition has been really key to promote the competition between groups, and an effective feedback mechanism to ensure that it is two-way feedback as well, so we're not just always giving information, we're taking it on board as well. And realising that we need a continual education programme. It's not enough to have a one-off induction, we need to keep giving this constantly.
Today's been really superb. I've really enjoyed it. There's been a real wide range of talks about antibiotic use and resistance.